Well, welcome to the Ambient Sensor Technology presentation. HHS Connect is so excited to bring you this webinar and our two amazing hosts. So it's my pleasure to introduce Annie Eubank and Mark McGran. Today's webinar is on ambient sensor technology and the aging population. Annie and Mark are two deeply passionate leaders who care about how technology shows up in the lives of older adults and people with disabilities. They believe technology should support people, not replace them, and should strengthen, not diminish the role of caregivers and direct support professionals. Their work focuses on using technology in thoughtful, responsible ways to improve safety, independence, and quality of life while keeping human connection at the center of care. Annie Eubank is the founder of Tech First Solutions, where she helps healthcare and community-based organizations use technology in practical and meaningful ways. Her work focuses on improving care, supporting independence, and helping organizations navigate staffing challenges without losing the personal relationships that matter most. With a strong clinical background and a deep understanding of how care systems operate, Annie helps organizations thoughtfully integrate technology into everyday services. On a personal note, I've had the pleasure of working with Annie, and her collaborative, pragmatic, and tech-forward approach continues to drive positive change across aging and disability services. Mark is the Director of Business Development for Emerging Markets with Nobi, and brings more than 15 years experience in safety and emergency response technology. He has helped introduce early personal emergency response systems and played a key role in bringing smart safety tools to market. Tools that help detect falls, monitor movement, and support people living more safely and independently at home. Mark's work spans care at home, senior living communities, disability services, and beyond. Annie has introduced me to Mark, and through our conversations, his passion for using technology to protect and empower people has been clear. We're really excited to bring them here today. Together, Annie and Mark bring a thoughtful, human-centered perspective on how technology can enhance while preserving the essential role of caregivers and direct support professionals. I'll hand it over to you, Mark and Annie. Thank you.
All right. Thank you. Hey, Mark, can you go to the next slide?
Certainly.
Oh, there you are.
There's us. Probably should have been there.
Yeah, there we go. There we are. Great. So welcome, everyone. This is, please, if you have any questions, please put them in chat. We have people that will, Kristen and team will look at the chat. We'll either answer them right away or save them to the end. This is a time, this presentation is about like what if I'm looking at ambient sensor technology, what is it and how can I use it? Will it help my population or family members? So for people that are with families and their loved ones, or if you are an executive director of a senior facility. So first is an overview, and then Mark will dive down in some of the details, like different sensors, difference between radar and presence sensors and infrared and things like that, to really sort of, he's going to get a little bit techie. Still an overview, but can help you decide what system might work for you. And then what is ambient technology, some of the specifics, how does it work, and then how to determine. So these are the things that we'll kind of cover. Next one. So here's an overview, like one slide overview. So if you have any other questions, please email us. Our emails will be at the end. So ambient means touchless. So ambient sensor technology, we're able to support people now in a way that we've never been able to before because of technology. And Mark's going to get into some of the old technology, like the 1975 technology and how it's grown and evolved to ambient sensor technology. So there's sensors of some sort with software in the space that the person lives. So home, an independent living center, a congregate living center for people with disabilities. So what do? They detect presence, which is movement, activity, and which includes falls. So why does that matter? Bathroom use. Someone's using the bathroom, again, not cameras. You can use cameras, and that is a way to do it, but cameras are only as good as the person looking at them. So this hardware and software will collect this data. So bathroom use, Maybe an uptick in bathroom use could mean a UTI. Someone that's not using it as much as they were could mean dehydration. That leads to a lot of other things. In and out of bed. It's, if you're supporting someone, either a paid staff or a family member, I want to know when someone's out of bed too long, not necessarily every single time someone gets out of bed, depending on their acuity, depending on their balance. But that's all where the system can be customized to the person. So I was able to divert my mom from nursing facility for 2 years, true story, using sensor technology. So she did get up 6, 7, 10 times a night. That is fine, but I did want to know if she did not come back to bed. And also, I didn't want to be woken up every time she got out of bed, because I was supporting her from a state away, and my aunt was in the same state but an hour away. And we really were able to see where she was, how long she spent in each place in her house, kitchen, bedroom, bathroom, living room, how long she was there. And we were able to see trends, and that can show if someone's feeling better. And Mark's going to talk about that the sensors do a lot more than just tell where someone is. And you'll be able to review these trends and give you insights that we would never have. We didn't have this 10 years ago, maybe even 5 years ago, where even either a paid staff or a loved one can see trends and can see someone maybe slowing down. What's happening? Should we go to the doctor, or detect a fall? So you'll be able to know a fall, and the systems that Mark's going to describe. Some are more sensitive than others, but it will detect a fall, so you know that it's actually a fall and not a false fall. And he's going to go through some of the history of the technology that can give false positives just because the technology is older. And that's all I have to say on that slide. I'm going to hand it off to Mark to start the history of ambient technology.
Thanks, Annie. And that actually brings up a really great point. I'm glad you mentioned it. When it comes to looking at how someone's living their life, at the end of the day, it is looking at those insights and trends and building on those. I myself am going through a bit of a neurological issue right now. Every time you get told something, you wish you could look back and say, oh, if I'd only known to look for that kind of thing. Guy flicked my finger today and my thumb twitched, and apparently that was something. But these are the types of things we can start to get ahead of and we can start to use. But before we do that, the goal here today is that you can start looking at all this ambient technology, this giant mountain in front of you, break it down to a manageable bite, and let's get control of it. Let's get an understanding. And the best way to do that, every time I explain it to someone, if I have the actual time like now, this is something I always want to yell the entire industry, is start from the beginning. Some of us on here are old enough to remember these commercials where we look back and we do remember the history of fall detection. It goes back to the 1970s when we had our first ones coming around. A lot of these, the famous phrase there by Life Alert, that actually was a real phrase. The concept was simple: put a button in someone's hand. Someone actually had an incident, they pressed it. When she called in, she said, I have fallen and I can't get up. And that's actually the person that ended up in the commercials. That's where we build things and where we started. But it laid that ground layer for us. And every ground layer that we find shows us the gaps and the holes of what we need to build next, but it still gives us a foundation. So that first foundation that we started with was simplicity. We tried to look at it and say, okay, how do we put a button in someone's hand they can easily press, goes to an emergency response center, then you go to emergency medical service to get help? And that was kind of the basics. Can we break that down first? And that was achieved. The second level was, okay, well, we need to start spreading out a little more. How do we accomplish more? What are the next problems that came up? Well, as we started to build more to it, we started to find, well, you got to charge it, you got to wear it. I know it sounds complicated, but you got to press it. But these are real issues that come up, and what they were built on was more of the social, the physical, the mental challenges that we have in front of us that we have to get ahead of, that we have to build upon to figure out. And that's where it led us to, well, charge it means remember it. That's a bigger task than we all like to admit. Where it involves an acceptance that you actually need it, being a willingness to say, would I have this in my home? Someone walks inside, they're going to see this, whatever it is. Am I okay with that? That's a big deal. That for the person that's actually using it, that's something they need to get past. And then can you actually press it? Now, all of these things led us down a road. And one of the biggest things that came out of it was a necessity of automation. So our first step of that was, well, let's try to add fall detection to the button. I could do an entire presentation on why, that has had challenges. It's accelerometers, it's gyroscopes inside of the button. But at the end of the day, you don't solve these problems. We didn't build on our foundation the way that we should have. And that's what led us to ambient technology. What we realized was that automation requires autonomy from the person. If we're going to have something that's going to help a person when they need it, this is where it comes up most. I'm sure, Annie, before you put sensors in, did you ever try a PERS button?
Oh, indeed, indeed. And we're asking my thought when I think about PERS buttons, which is personal emergency response system, is we're asking some of the most vulnerable people in our population to press a button at the most vulnerable time in their life. So as an occupational therapist, it's typically not going to happen. And there's lots of studies out and there's even some health plans that are not using the PERS anymore because of its lack of use.
Exactly. The answer's in front of us. It's obvious. Ambient technology is really where we need to go. But there is no ambient technology store. You can't call Walmart and say, can you send me the ambience? That's not the way that it works. You're going to get some ambiance instead, which can also be nice. But that's where we need to take technology further. And that's where we need to start describing. So when you look at ambient technology, as Andy kind of alluded to earlier, it's technology that automatically, and that should be underlined 3 times, collects data on its surroundings to trigger actions. And that creates 2 different sides of this puzzle that are being thrown at you guys all the time. The hardware and the software. And those 2 can exist separately, and they both do very different things. At the end of the day, when it comes to the hardware side, the focus is generally the same. Now, I'm not going to focus on Nobi particularly, just in general, any hardware that's out there, they're trying to accomplish the same goal. How can I collect the most effective and quality data that's inside of this space so that I can send it to another side or pass to a software side, which can analyze and create actions that'll actually take us to that next level. And that's a huge important piece. How can it do its job? So when we're looking at our hardware side, the first thing you need to consider, the number one thing on your list, if you want to know, is this a quality product? Is this a strong product? Is understanding that quality of data is key. That's kind of your first line to it. And Annie, I'll throw it to you again. You've had plenty of experience with this side.
Oh, there's different, and I think your next slide, I think it's coming up where it talks about the different types of sensors.
Oh, yeah.
The higher the quality is going to increase the accuracy. And so throughout my experience, working at large companies, health plans, a tech company, and with families, when the quality is low, that usually means false notifications. When there's false notifications, there's fatigue alert. On the responder side, so that's either a family member or staff member, even the person being supported. So Mark's going to go through why accuracy is so important, why data quality is so important. It gets a little techy, but it's important. So ask questions like, why is radar? Tell me about radar. Tell me about infrared. This is the time to talk about it if you're interested.
Absolutely. So the first layer is, what are we actually talking about when we say data quality? And what I like to do is break it out in 2 points. We have quantity and we have accuracy. Now, if you imagine one side, we have a person on the ground type scenario. Well, one side of that might be quantity. Quantity without accuracy would be like having, a camera in the room with a lens cap on. It's streaming frames of images through, but there's nothing in the images. We can't get anything actually from it. On the other side of it, it might be a single image of a room with high accuracy, but no quantity. That leaves us without context, which is extremely important. At the end of the day, a person lying on the ground with their eyes closed could be sleeping, could have blinked, could be dead. I mean, you run across the spectrum and you run into a lot of these challenges, and that's where we have to start to really get ahead. So that's what we're going to try to look at. And when what I like to do is take that to a technology level. So when you're looking at the hardware at the front end, this is kind of the spectrum of quality that you start to see. And it's kind of what I say, how good is the technology? So on your low data quality side, you have more like motion detectors. Something goes by, it could be a shadow in the room, could be a person going by, could be, dust falling down, but it kind of just triggers every time it thinks it sees something. A lot of high quantity there, a lot of information coming from it, very low accuracy as to what you're actually seeing. On the other end of the spectrum, you have your infrared imaging, and that's where things have kind of come along. I've worked with all these different types of company. I have been with a radar company before, but infrared imaging is where we really got into today, where that's going to give you your highest quality and accuracy because you can actually see what's happening inside of the room. And at the same time, you get a lot of context from it, depending on the solution that you actually choose. Radar steps that back a little bit further. There's a lot of pinging back and forth to try to develop not an image that you and I look at and generally know what's going on, but kind of something, an algorithm might be able to take guesses at. Audible sensing, Wi-Fi are kind of steps further back from that. Any of these could be an entire presentation. But that gives you an idea when you're starting to look at your solution and you're saying, what is right for what I'm trying to accomplish here? This spectrum of information is a good place to start saying, okay, first things first, let me make sure that as I'm looking at this, I'm getting the level of quality that I'd like to see and using the right technology for that. In the wrong environments, that low data quality, is going to end up with high numbers of false alarms, missed alarms, people hurt. Low risk environments, hey, I just need it to, open the door at the supermarket. That's perfectly acceptable. Okay, occasionally a squirrel runs by and it opens up or the shadows change. That's not that big a deal. Or even, if something flickers at the front and the front porch light comes on occasionally when it doesn't need to, not a big deal. In our scenarios, obviously a lot more high risk, high quality being on the other end of that is going to be much more important.
Can I give an example of the motion,
yeah.
Mark? So motion sensors, there's absolutely nothing wrong. That's what I used in my mom's house. It will pick up if she moves from bathroom to bedroom. So like an alarm system was in my house, not cameras, but just a sensor would know I was there. To detect a fall, the motion sensors would, like, nothing's happening. They don't detect in a bedroom anywhere. So it's low accuracy as far as I know that there's no sense she's not moving at all when she should be according to the timeline. So I don't know where. I know probably like if the living room picks her up and then there's no movement, she probably is on the floor in the living room. Probably. I think that, and the Mark will go through that. And as time has gone on, and like in radar, and Mark, you correct me if I'm wrong, radar pings off things. So it will send an axis and it will ping off of like the furniture and different things that are in the room to create what you're saying, that algorithm. So it creates like, it knows what's in the room. But if you move something in the room that's new and different, like a wheelchair, it has to relearn it. So each of these, nothing's perfect and nothing, you don't like, I always use motion sensors, or I'm always going to use radar, or I'm always going to use infrared to really understand which one would be used. Like Mark just said, in a low risk situation, my mom was moderate risk for falls. And when she did fall, when we could see her, when we were live with her, it was like a little crumbling sort of fall. If it was someone that was at high risk for fall, I might want to try something different, if that makes sense, so that I know, was it a hard fall? Was it a soft fall? What happened beforehand? Did she grab onto something? Things like that. And we'll talk more. Hopefully that's making sense. Thank you so much, Mark.
Oh, absolutely. And you could bring up a good point. When it comes to your motion detector side, typically in a good, strong platform, what they've done is they developed algorithms over time. They start to say, we typically see this many pings from these sensors at these times of day, and then start combining those together to say, hey, when I see things change from that, that's when I might say, then I trigger an action of some kind. When it becomes challenging is when we have no information. So there's times of, night, for example, someone gets out of bed or slips right out of bed and falls to the ground. We have no motion or a limited amount of motion we always see at night because normally a person's sleeping anyway. So now we have a huge gap and more of a guessing game of what's going on. The fastest I've ever seen ping an alert for potential fall will be 30 minutes. Now with radar, um, I've used it in the past, been great. You've got pings doing about 1,000 times a second. Again, creating kind of a mesh of information coming back that becomes a little more advanced and start guessing at what you're seeing. And you can start to try to draw out zones and different areas inside of a room where now we can start to get a little more advanced and say, okay, well, that should be the bed area. So we should be this type of thing. And then remove that. Typically, you do get some decent fall detection. If you can get the angles in the room, something I chat with challengers a lot. But the other thing is you are going to get a higher number of false alarms. And that sometimes, again, that can be balanced out. With infrared imaging, that's where you actually are getting an image. So now we're able to, it's just kind of the next step. I would say, when I was at Radar, I said the infrared guys are cheating because they had a chance to work with something that was an actual picture. So when you're training your AI to actually work off something, you have detailed image to work with. You can say like, yeah, that guy's sleeping. This woman's walking across the room, and all these different activities. And also, the road ahead of us is absolutely amazing. We'll start to be able to pick up on because you can get more detailed with the information. That's enough on that side. I think we've got a good idea, the good grasp of this is kind of your initial scale. This is step one. I want to look at the technology. I want to say, are we working on the low data quality side, the high data quality side? Which one makes sense for us? And then that second step is we start to break down things a little bit further. So any of these that you choose, you need to start asking these next questions. What is the privacy level going to look like, the aesthetics, power, communication, the environment? So let's break those out a little bit further because they can vary pretty significantly. When it comes to privacy, you need to ask the questions. As things get better, we need to take this more and more seriously. I think we've had all these conversations with everyone from Amazon to Google to Facebook across the board, anyone that's got a security system. But what can anyone see? That's a good first question to ask. And I do mean anyone. Does it have to go back to the hardware company? Is someone seeing it there? Is someone seeing it at the local level? Is the family or the family members going to be looking at it? Are the neighbors going to be able to see it? What's being sent out anywhere at any point in time? And then also, when and where is it sent and saved? So is it going to be kept somewhere? These are roads that suddenly you're traveling down the CCPA or California Consumer Privacy Act along with a number of other states. You need to ask the hardware company, do they hold the information? In some cases, they might sit there and say, oh yeah, we keep it forever because we continuously improve our AI. That might be problematic. Can it be customized? I think is a crucial question. Not to plug Nobi too much, that's not the point of this, but just as an example, when it comes to Nobi, we're able to show what you see right here. This is what we call, this is one of our views. We're able to look at it and say, okay, I can see more of a stick figure here. I have something to look at here and say, there is a person. I can see generally what they did inside of this room, but I cannot see the person that's taken out of it. Now, on another level, you can choose no notification or no imaging whatsoever. So Nobi processes on the light, deletes everything off the light itself. There's never an image that's ever sent out. And then you can go to full image. If you start looking at your market, you have to start asking that question. Am I helping someone of really high acuity, maybe really low acuity? And in those, what level of privacy is necessary, but also what level of privacy provides us the best care for that individual? And it's finding that balance. And we do see that change kind of across the board as they're putting things out there.
Hey, Mark, when you said Mark's really not, if he plugs Nobi, Nobi is a sensor that any company can use. Any remote support company can use Nobi. Nobi's not a competitor with a remote. They're not a remote support company. So I think the people on the call, it's something they could use.
Absolutely. I didn't want to plug it to education's important to me. Like I said, a lot of this has been stuck with me for a while. Nobi is a light that's just a short version. Is a light, sees what's happening inside of a room. At the end of the day, plugs into really any platform that's out there. So we can talk about that more later. Actually, that might come up in a little bit. But moving on from there, that brings up aesthetics.
Hey,
Oh,
hey,
can't
Andrea.
speak today.
Before you move on, Mark, Andrea said absolutely, exclamation point. I agree, exclamation point. So
Excellent. Yeah, it's huge. You will need to find a balance later of the family members and their overcare versus usually the user, the person being cared for, and their want to maintain that independence, that privacy. It shouldn't just be around laws; it should be around the individual too. And that leads us to the aesthetic side of it and the acceptance side of it. We are shoving something into someone's life that can make them feel like it's dramatically changed. Hopefully, it doesn't change anything because we're using ambient technology. But is it natural? When you walk into the home, what I would say is, the grandkid test. Are they going to walk inside and say, "What is that?" Would someone else notice it at all? What physical changes are required to the home? These can all be a big deal. Does it require plugging something in and it just does it over in the corner? Nobody notices? Is it something that when you walk into a room, you would actually see because it's different from what you'd expect to see there? Does it require wires to run up the side of the wall or around the room? These are physical requirements that need to be considered when you're looking at the different solutions. It's not as simple as, well, I've decided I like infrared, so I'm buying infrared. Just like you can't say, I want to buy ambient technology. That's too big a phrase. You can't just say, I want infrared. You need to start looking at the individual device that falls in that field. So we're starting the funnel up here at the quality side, deciding what's necessary. And we should be funneling down to our solution as we look at these different things. And aesthetics is a huge one. Over at Nobi, one of the things we've argued for a long time is ugliness kills.
It
And by
does.
that, I mean, go ahead, Annie.
Oh, just one comment. I also work with Optum and new product development and in the ambient space. And so things that do plug in that are in people's homes, they get unplugged because fortunately or unfortunately, I was the one keeping the spreadsheet of all the things that were unplugged and not operating. So a alert would go back to the company and like, so-and-so's house or room is offline. And I love that this is a light. I was like, wow, this answers a lot of questions of all the different products that I've worked with. It's a light that's up and doesn't have a plug. I'm like, this would certainly have helped me in that pilot that I was working on.
Absolutely. And those are the things we want to look at. So if you're trying to decide in your technology at which one makes sense, ask that question, push against it. When they show up and they say, no, it looks perfectly fine in the home, say, can I see an example? What would it look like? And that kind of stuff. You want to see that thing. Make sure it's not some AI thing too, where they show it up by itself. And it turns out when you actually put it in, there's the wire they photoshopped out of it. But you want to know those things. And that leads us to power. And the next questions. Anything that you put in that's going to fall on this ambient technology side, it's going to need some electricity. I've yet to come across something yet that is powered by the hamster wheel or sunlight. But at the end of the day, you got to ask the question, does it need to be plugged in? I'm going to jump from the first bullet to the third one here. Is there actually an outlet there? If someone says, oh, no, it looks really nice. It goes up here in the corner of the room, not even going to notice it. How's it getting power up there? I mean, are you pulling power across the house? Wait a minute, are you running a wire down my wall and over to the outlet on the other side of the room? These are questions that are come up. Or the next one, does it need to be charged? In some cases, I've heard ideas about batteries. I remember asking the CEO of a radar company I worked for and saying, why can't we just put a big battery on it? And he said, well, the battery would be so big, if it fell off, we'd have bigger issues than the person falling. So, those are things you need to consider and you need to question. And the next one is communication. Any of these ambient sensors, like we said, are collecting and they can be processing. I know others have this too, but Nobi has a processor on the light itself. So it actually does its decision making here. It's not just streaming out to the cloud, which again, privacy concern. But, that's something that we're doing right there. But how does it get that information it collects from point A to point honestly, at this point, it's B, C, D, E across the board. How's it going to go? Is it going to be Wi-Fi? Is it going to be cellular? These are questions that are going to come up and things we have to address. Does it require another piece of equipment? In some cases, you might hear we have a new technology, great price point, but at the end of the day, you find out that, oh, well, the base unit on it actually has, 10 times the cost that has to come along with it. So it requires this other piece of equipment, or no, there's no fee that comes along with it because it doesn't use any cellular or anything. But then come to find out, well, that's because the other piece that it has to communicate through is the cellular router. Ask those questions. How is it getting that information from point A to point B? And does that actually add cost at the end of the day? And the last one that we had talked about before is looking at environment. So who's the solution actually being made for? And, well, Annie, I'm going to throw this to you. You've been in the environment space personally. So when you're doing the analysis, talk about how you go through this side.
Oh, and Brady does too. Brady, I see you're on. You don't have to speak. Don't worry. I'm not putting you on the. I'm calling you up. But I love that some systems, and I'm talking like probably 20, 25 systems that I've worked with. Some systems, if you say, can you connect to this? Can you connect to that? Even in the software in a assisted living facility to a medication dispenser. I really like Nobi or any system that says we can seamlessly integrate with anything. Not let me check. I'm not sure. I have to work with the engineers, but I love that and how important that is to support someone so it happens quickly and easily. And this is technology is evolving very quickly. So to be able to say that, I found to be very helpful. Is that what you were looking for?
Absolutely, because I think what you said without saying it was our first bullet. You need to consider with the technology, who's the solution made for? Who is the person whose home is this actually going into? There are significant differences between what is needed inside of a senior living environment where we can connect to a nurse call system, to their EHR systems, to kind of get things to those nurses right there in the community. There's a big difference between all the layers of that. But even furthermore, if we start to look at it and say, okay, I'm going to take that product, I'm going to shove it into a independent senior's home. This person's living by themselves. That's a different problem. Suddenly, no, you don't have a nurse down the hallway you're notifying to go to room 107. If a fall happens in the middle of the night on Tuesday, we need to make sure that it's going to a responsible agency, an emergency response center, is what we call them, who are able to analyze the situation and also go through a correct action plan. And by a correct action plan, that means not jumping to every time we get an alert across, we're rolling out ambulances to the house. This is about cutting back on those unnecessary responses because the user absolutely does not want them. The state absolutely does not want them. The local EMS absolutely does not want them. It's not good for anybody. So we want to make sure we're controlling those things or we're thinking through those things. So when you're looking at your hardware, you ask the question, can it connect to different softwares? If I approach you with this one issue, if it's intellectual and developmental disabilities, so the IDD space, are you going to hand me the same technology you put into senior living that you put into independent seniors, or can it connect to these other ones that we use? You need to ask that question. In some cases, they might say, we have an internally built one. This internally built one does the job for your environment. That's fantastic. Nobi has that, for example, for the senior living space. We can connect to a lot of other stuff, or we can actually provide you something that is built specifically for senior living. When it comes to our independent living, when it comes to our IDD, these other areas, we work with partners, different software solutions, and we're willing to integrate with more. So if there's those out there who say, hey, I wonder if this could work with that, please bring it forward. That's the conversation we could have. But that's the answer you should receive. It is not a one size fits all. The next thing is, do you need to go to different apps? That's kind of going back to the same thing. And then who responds is the biggest question I think helps you to answer this question. So if you're sitting there and you're wondering, well, I don't know if this works. Does this technology work in my environment? Well, the first question you can usually start out with is say, well, who responds? And if they go through an answer that doesn't match up, there's your big clue right in front of you, smacking you in the face. If you're sitting there and saying, hey, I've got an independent senior or someone that's intellectual and developmental disabilities, and they say, oh, yeah. So what it's going to do is it's going to call their first caregiver on the list. Well, at 3 a.m. on Wednesday morning, that is not an effective solution. That didn't help anyone in the process because at the end of the day, family members are not emergency services. Even at the middle of the day on a Saturday, people travel, people have jobs, people have sporting events, people have kids. There are a million things that are out there, and we can't have that expectation. So we need to adjust to our environments. And usually a good question to figure out your environment is start out with who responds. And if we're breaking it down from that level, that's when we get to the point where we started to have, okay, a good look at which technology makes the most sense for us and what we can work with. And then it's more of a balance of the scale. On the one end, as I mentioned earlier, you're going to have your families, your caregivers, effectiveness, top of the list by far. That's what they're going to care about. How do we make sure that my loved one, the person that I'm caring for, is given the absolute most care and they get responded to the fastest? Our independent person living inside of their home, whether they are 14 years old or 94 years old, independence and privacy are going to matter to them. Absolutely, without a doubt. Chaining a person to a chair and saying, well, now you're safe from falling is not an effective solution. And so that's where we're balancing out our technologies. You need to go through this list, not only internally, but also kind of considering with them as well and saying, okay, where are we able to push and pull from to make the best solution that's available for you and really get something done? So balancing out that aesthetic look, having discussions about the security side, the privacy side. What do you guys do with the imaging that you take if you're going to take imaging from it? How do you make sure that images are deleted and not being saved? And oh no, we threw them back into the algorithm, which none of us like how often that happens to us today. But these are important questions to bring up, and that's really the balance you want to find. And then lastly, that's when you do want to get to your software. So once we've gone through our software front or our hardware front, we've kind of understood this is the technology I think that makes the most sense for us there. Now we can start looking at our software side. And Annie, I know you've got a lot to say about the software front.
Oh, just that I wanted to do all of these things, like truly predict trend analysis, where it's not a Excel sheet full of data, but it's actually something that people can read. So the dashboard, just talking to many families and executive directors of different senior living spaces, like something that can be used. So trend analysis, so they actually can predict, like, is someone feeling poor enough that they need to go see the doctor, or so we can decrease those incidents, decrease incidents of very serious medical conditions. And I want it to be able to detect a fall and not have false alarms. And not me. These are things that, like, in my space and my work in the last over 5 years now, being in the ambient sensor technology space, is the false alarms. So I want it to be real. I want the data to be good enough so that it is real. Otherwise, what happens is no one uses it. The family just turns it off, and or the facility doesn't use it. So these are just things to really look at when you're looking at a technology. How does it do all these things easily? These are just things that Mark and I think are important. We could make the list. I think we do have a list that's 2 pages long, but these are our top few.
Yeah, absolutely. It's starting to get past, looking at the okay, I've just got the data across. Give me data. I think a lot of people think that way, especially if you're on the, the technology side of things, the IT side of things. Give us the data, we'll work from there. But the fact is, any of these technologies, the more advanced ones, have both sides of it. You do have that high quantity is a key to our high quality. So at the end of the day, it becomes too much. A bunch of screens where, oh no, look at all these charts and graphs and numbers are nice, but in reality, what we're looking for is how do we get to actionable outcomes? How can I sit there and start to say, don't show me how many bathroom trips they've had, but tell me when you think there's a UTI. Don't tell me every day how, they slept last night. Tell me when they're not sleeping right. Tell me when that's the problem. When too long, too short. When we're looking at staff optimization, how's this actually going to apply back to that? And that's where the software front can really be a driver there and take us to another level that I think we're ready for on the technology side and on the industry side across the board. We're all ready to take that steps and gotten more used to it. So that's the path we want to go. I think by looking at that hardware front first, understanding, kind of using that funnel we've created and that understanding, saying, okay, I think this is the hardware piece we want to have in place. Choose Nobi, but but as you go through that funnel, and whatever you choose, your second side of that is starting to look at your software and saying, okay, can we plug that in here so that we can get these outcomes that we're actually looking for? So we can create these actions we're actually looking for, because they are going to differ for everyone's needs and the different markets that we're helping out with. So that is the general presentation. We'll definitely share this. But does anyone have any questions they'd like to ask?
I think we have a pretty educated group on the line.
I think so too. And that's fantastic. And I'm just going to say, obviously, we explain things so well. There's not a single question, which is also fine. But no, please use this as a guide. Challenge it. Write me an email and tell me why I'm wrong. Always happy to hear that too. It's a chance to learn. So please bring that forward, and happy to go through anything with you. I think from a follow-up side of things, you guys do get a follow-up email after the session with the link to recording and slides. If you want to share your participation, we always appreciate that. And then please do stay in touch as well. Thank you so much.
Mark,
Kristen, anything else?
I was going to say thank you again for enlightening us on this technology and how it's evolved. I've had the pleasure of seeing this once before, but it always amazes me of where we've been and where we're going. And we appreciate both of you for walking us through that. So thank you so much. If anyone does have any questions after this is done, don't hesitate to reach out. We'll get them to Annie and Mark and get your answers. I know you're a very savvy group, but you never know. Thank you, everyone. And Annie, Mark, again, thanks for hosting today.
Thank you.
Of course. Bye, everyone.
Thank you so much.